From the WRAL News Studios in Raleigh, North Carolina, this is the WRAL Daily Download, an in-depth conversation on a story worth talking about.
Welcome to the WRAL Daily Download. I'm Julian Grace, and today's deep dive conversation is with WRAL documentary and investigative reporter Cristin Severance. She is here to talk about the upcoming new documentary, critical term, Why Are Black Mothers and Babies Dying? You know, just the weight of saying that is so heavy.
I know.
Very heavy.
It was, and you are my co-reporter on the project, and you know it was tough. This is something that kept me up at night.
I bet it did. It's scheduled to air Thursday, September 22nd on WRAL at 7:30. And as you stated, I get the chance to tag along with you on this quest for information to inform the public that something needs to be done. Cristin, I just want to jump into this because we don't have much time. Why did you tackle this topic?
I mean, when you learn that it's happening, how could we not do this? I am, the investigative documentary reporter here. We try to do, our goal is to do 6 documentaries every year. And so we want to pick the most important topics. This was something that I had learned about a few years ago, and it was always in the back of my mind on why is this happening? Why are mothers dying in childbirth? And then specifically, why is this happening to Black moms and babies? And so, we did a brainstorm and decided this was going to be our next topic, looking at why it's happening and what can be done about it. And then I think that same week, you had emailed.
I did.
Yes, our managers, and you said, hey, how about this story? And you had, specifically focused on infants, right?
Right. It seems like all the stars were aligned. Mm-hmm. I am a father of 4, and this was the first time I heard about how bad the problem is. Searching for content one day, I come across the Wake County Public Health Department, and it's literally this plea for African American families to come to this free conference to learn how you can safely deliver a baby and what type of resources are out there. And I'm like, why just African American families? And then I saw the statistics. I saw the numbers, like this number. It made me do a double take when I saw it. It basically stated that Black babies have more than 2 times the chance of dying before they turn 1 in North Carolina. That statistic right there said, oh man, we got to do something about this. So I was elated to find out you were already on the track with this.
Yes, and just talking about numbers, the county told me statewide 800 babies, 800 infants died in 2020 in North Carolina. And there's always a lag in data. So those are our most recent numbers, but 800. And one of the officials in the doc, one of the experts that we interviewed, said, if this were any other tragedy, 800 kids, she said if this were a school bus accident or, some other unimaginable tragedy, people would be just up in arms. People would say, we need to do something about this. And, that's how we feel. We need to shine a light on what's happening.
Shining the light on what's happening. Do you feel like people understand the magnitude of this?
No.
I don't either.
I don't. Do you? When you tell
don't.
people that we're doing this documentary, what are some of the reactions you get?
Really?
Yeah.
Like, really? It's really that bad? And these are people who look just like me that have no clue. Now, I will say this. My wife, she has articulated to me on a number of occasions that she felt like she was not heard during doctor visits. And then when we started looking into this documentary and I was asking her questions, she said, oh yeah, well, during the birthing process, I didn't feel like I was listened to. You remember I switched doctors? And I was like, whoa, wait a minute, you did?
Right.
And I just felt like the worst husband in the world in that moment. Like, oh yeah, you did. But that is a big component because many moms feel like they're not being heard, right?
Right. That is
I'm in pain.
Yes, I'm in pain. Something is happening. Something doesn't feel right. And time after time, these, Black moms are saying when they're in the healthcare system, when they're talking to providers, they are ignored. They are brushed off. They are truly not listened to. And it's not just, oh, that's a shame. I mean, sometimes the consequences are, they don't make it.
There's always like those protective factors that are out there, right? If you're educated, don't live in poverty, you make all your appointments, you have a path to a successful birth. But there was a study that basically stripped all that away and said, even if an African-American woman is highly educated, even has her doctorate, she still suffers the same chance of possibly not delivering or dying at childbirth as if a mother who wasn't educated. Right.
It was fighting at birth. It was a study done by Duke, and you actually found this. You brought this up during one of our very first interviews, and it shows that a Black woman with her doctorate has less of a chance of surviving pregnancy than a white woman who never went to high school. And so many things that we thought, that most people think, if you have a certain education level, if you have resources, a socioeconomic level, you're fine. You're protected. You have access to this great care. But that's not what the data shows.
All right, we could keep going, but we have to take a break right here. We will be right back after this break with WRAL documentary and investigative reporter Cristin Severance. We are talking about the new documentary, Critical Term: Why Are Black Mothers and Babies Dying? We'll be right back. Welcome back to the WRAL Daily Download. I'm talking with WRAL documentary and investigative reporter Cristin Severance about the new documentary, Critical Term: Why Are Black Mothers and Babies Dying? Cristin, since you've been here, you haven't been here a year yet. That is crazy.
I know.
You and Jay have been producing so much content so quickly. But what I love about your docs is that whether you're talking about crime in Durham or the education system here in North Carolina, you leave people with a sense of hope, like some solutions that maybe we can take with us to make the situation better. You found a partnership that is really critical to tackling what we're facing right now when it comes to Black mothers and Black babies.
It was so incredible to watch, to really learn about this partnership. And then you and I had the chance to really see some of it in action. So basically, UNC, Duke, and Vanderbilt, there are these three midwives, these incredible midwives who are running this program. And it's called the Alliance of Black Doulas for Black Mamas.
Okay, yep.
And they basically train doulas. They do this extensive training with doulas because you can get certified as a doula in a weekend. This is an 8-week course. And so the doulas get the training for free, and then they're matched with Black families. And the families get the doula for free. And so I guess we should describe what a doula is, because many people, many people don't know. It's a coach. They are not medically trained, but it's a coach for a mom. So you are there. Well, you're there during pregnancy. You're there for all the appointments. You come up with a birth plan, and you're there. You're there for the labor, and you're there after. And the relationships these women have formed, I'm getting chills. It's so amazing watching them, because these women, the moms, know the stats. They know that they're 3 to 4 times more likely to die from pregnancy-related complications. But they want to be moms. They're terrified. And so this doula is calming them down, is making sure they're listened to, is making sure they're an advocate. And, many people, look, this problem is complex and large, but the doulas are a big piece of the solution.
We were in the room with, just to give a little perspective, with a number of doulas and a number of expecting moms, and it was so emotional in there. But the constant theme that I found is that every mother that got up and spoke, they stated how indebted they felt to their doulas.
Oh, right. And, we were able to, talking about this, Many people listening are probably wondering, well, why? Why is this happening to Black moms and babies? And, the experts will say, as you said, Julian, the moms don't feel listened to. But it's also related to structured racism. And, we were able to talk to these doulas who are in the rooms. Hey, have you ever had a mother not be listened to? Julian, you asked that to all the doulas.
Right,
Every one of them stood up.
Right.
We were able to say, have you ever experienced racism in the healthcare industry? Every single one of them stood up. Extremely powerful moment. And then we're able to sit down and say, please explain.
Right.
What did you see? What did you hear? Because when you hear right from these doulas, right from what they've seen, it's really hard for anyone to say, well, that's not happening. Right? Like, that's not. And we also got into, the history, of course, and some problematic training. And, we get into so much of it in the documentary. But I think it was very powerful to hear directly from moms and doulas on what they see and experience.
Cachet is out there as well.
Cachet is through
Holistic
Duke.
approach, right?
Yes, that's through Duke. So you interviewed,
Dr. Shannon.
From Duke, who runs the program. They basically said, do we have a problem at Duke?
Correct.
They looked at their data, 35,000 births over 5 years, and they said Black moms have, nearly 2 times more likely to have complications, right?
Right.
So they
do this holistic approach that I was so impressed about. So essentially, if a mother is having issues with transportation, they note that, and they put resources around that mother to ensure that she gets to all of her appointments. Because before, they had a system in place that if you were more than 5 minutes late, you would have to recancel.
Yeah.
Duke said, hey, we're not doing that.
Yes.
We're going to make sure that we support this mother and what she needs. If there's food insecurity, we have resources to wrap around this mother to help her get through this process. And I thought to myself, what if every mother in the country had this opportunity?
Right.
Where would we see our birth rates?
And Duke also, Duke looked at where are these moms living? How, can they get to these appointments? And no. And so, they changed the appointment policy and they changed the rescheduling policy. And just by changing those two things, 89% of moms made their prenatal visits. 89%. Then they gave each mom a family coordinator because a lot of moms come in with these underlying conditions. So they gave each Black mom a family coordinator, basically just a person helping them work on anything not related to the pregnancy.
Right.
Doing those two things, 6 to 9 months of work, 27% reduction in the pregnancy-related complications.
When I was talking to Dr. Shannon, he said, we want to make this available to all hospitals across the country, this system. And I thought, wow. So it's just not about Duke.
Right.
He said, this is about saving lives. And I thought, man, that is special. So these are the solutions that I'm talking about that's out there. And that is one thing that it was just so gratifying in working with you on this piece because it is heavy. We talked to Ashley, a mother who has went through tremendous loss. But then hearing these opportunities for possible solutions. We'll get into Ashley in the doc. I don't know if you want to elaborate on her story at this point, but it's just so heavy.
Yeah, Ashley, it's such a sad story. She, when you talk about not being listened to, so she had 5 miscarriages. 5. And she got pregnant a 6th time and thought this was it. She made it, 23 weeks, and then she had her baby. She had her baby too early, and doctors couldn't save him, and so she lost her baby. But because she suffered that loss, she said doctors finally listened to her.
Finally. We're talking about after 5 miscarriages, they finally listened to her.
Yes, 6 pregnancies. 6 pregnancies. And so doctors listened. They went in to see what was happening, and it just took. It was blood was not getting to the babies because of extra tissue. She had a procedure. It was outpatient, and that's all it took.
I think those, after they watch this piece, they will find ways they can on how they can advocate for themselves.
Right.
Cristin, I think your passion it was shown and evident throughout this piece. You're a mother of twins. But the question I want to leave you with, why should someone care that's not a mother, that's not a father, or not African American? Why should they care about this?
Because they're a person. They're a person. I mean, are you okay with this happening? Are you okay with moms and babies dying when 60% is preventable? And I think most people would say no, they're not okay, and we're not okay with it, and that's why we're doing this.
Wow. Is there anything else you want to leave us with before we wrap up?
Thank you, Julian. It was so great working with you on this, and I hope people watch it. They will be sad, they will be angry, but they will be left with hope, because there is so much incredible work happening in North Carolina around this issue, and it's going to save lives.
You can watch the documentary Thursday, September 22nd on WRAL at 7:30. Thanks again for listening to the WRAL Daily Download. You can also listen to the entire WRAL newscast in podcast form. Find WRAL News Daily in your podcast app. The feed is updated with new newscasts multiple times per day. Have a great day.